Good morning all. Today's my lecture is on Bell's palsy. This is the revision class, so I am going to tell you the superficial way, and in the last you have to make some of assignment. But I'll try to explain a little harder so that your revision will be done. Alright. So for introduction, the Bell's palsy is a paralysis actually. The severe weakness of the nerve that controls the facial muscles on the side of the face. The facial nerve or the seventh nerve, is involved in this. You have seen many patients in the hospital or in the diagram of your books. If you open your book, then you will come to know that there will be, the drooping. There will be a muscle weakness. The patient won't be able to. The one side of the face will be drooped, so he or she won't be able to smile properly, or the facial expression will not be normal. So definition, the Bell's palsy is actually there will be I told you that there will be facial paralysis, and the seventh cranial nerve is affected, which causes the temporary weakness of the muscle or the one side of the muscle, and the symptoms may vary from person to person. So there are two types of the symptoms, like one is partial palsy and one is complete palsy. In the partial palsy, there is a mild muscle weakness, and in complete there is no movement at all, or it is very rare, right? Then the cause is idiopathic, but still we do have some viruses. We have some viruses which leads to this, which can lead to this one, the Bell's palsy. So the first one is herpes virus, due to which it is very common cause, and it causes inflammation in the facial hair, due to which the nerve will be compressed, and these kind of symptoms are shown. So the herpes simplex virus, including the other simplex, the HSV1 and herpes simplex virus 2, which causes the genital herpes. All right. The varicella zoster virus, which includes the chickenpox, is also an etiological factor. Then comes the facial nerve. In the facial nerve, facial nerve, the seventh cranial nerve passes through a narrow gap of the bone and the ear. If you see the anatomy, so in this, what will happen? There will be compression on the facial nerve, which signal actually that brain sends to the muscle of the face, so it gets blocked, and due to which the facial paralysis occur. And there will be a restrict of the blood, and obviously if the blood is restricted, the oxygen supply is also restricted to the nerve cells, which causes the facial weakness and paralysis, characteristics of the Bell's palsy. What will be pathophysiology? Actually, it is representing as a type of paralysis as an ischemic necrosis, because I told you that there will be no oxygen supply to the facial nerve, due to which necrosis will occur, and there will be an increased tearing and painful sensation on the face. Might radiate to behind the ear and in the eye, due to which the patient may experience speech difficulties, or the slurred speech may be there, and he won't be able to eat, and the affected side owing to the weakness. All right. Then comes the sign and symptoms. The sign and symptoms. The sign and symptoms actually. There will be, sorry, it is a writing mistake. It is actually irritation. The irritation will be there for the affected eyes, such as dryness will be there, or there will be, or might be there will be an increased tear production. Pain underneath the ear on the affected side of the face, or maybe drooping of the mouth on the affected side, as I told you before. Dryness of the mouth will be there. There will be no saliva. There will be an impaired speech, or difficulty in eating or drinking. All right. Next one is uh, you know this one, weakness of the paralysis in the one side of the face, and it will cause the mouth droop, as I told you, and altered or reduced sense of taste will be there. Pain will be there around the jaw or behind the ear. Headache will be there, or dizziness might be there. What will be the diagnostic evaluation for the patient with this one? So we have to check for the history examination, whether we have to check that what kind of history he is having, is there is any genetically previously their mother and father was having this facial palsy or not. Next comes the physical examination, that what we are going to do in the physical examination. All right. The physical examination we have to see whether the patient, having the facial expression normal or not. If yes, then we have. If not, then we have to go for the further investigation, like MRI, CT scan, electromyograph. We have to do that is in this what we have to do, it is actually a very thin needle or electrode that is inserted through your skin into the muscle, and an oscilloscope is a machine which is used to measure the electrical activity of the muscle and the nerve, and the information is provided by EMG, can use to assess the extent of that, how much is the nerve damage is there, how much is the extent of the nerve damage is done by the EMG machine. What should be the medical management? The medical management is based upon the extent of the disease condition, that how much it is spread to our body. So first of all we have to leave for the sign and symptoms. As I told you, in the sign and symptoms like this, there was a, first of all, main was dryness and the pain was there. So for the pain, what we are going to do, we are going to give pain relievers like paracetamol or NSAIDs. We have to give non-steroidal anti-inflammatory drugs. We have to give ibuprofen or effective painkiller which is suitable for the patient. Then before giving the pain relievers, if the patient is not up to that stage, we can provide the patient hot and cold treatment, like hot bath or hot water bottle placed on the affected area, like on the facial expression. If drooling is there, then we have to place, or pain is there, then we have to go for hot and cold application. Then what it actually does, it actually erase the pain or ease the pain from the affected side. The cold treatment, such as an ice pack or frozen vegetables placed on the painful area, is also effective. Like any kind of ice pack you should apply on the patient side where the patient is having pain. Then it will also relieve the pain. Then it also relieves the pain. Then relaxing. Try to relax in the crucial part. We do not have to worry about the condition, because if you regularly start thinking over it, then definitely it can make the thing worse. All right. So ask the patient to relax. Whenever you are counseling the patient, ask the patient to relax, and then you have to provide the medications. All right. So as I told you before, that there will be the swelling. So in the swelling, what you are going to do, you are going to give the anti-inflammatory drugs like corticosteroids, NSAIDs. You have to give prednisolone, which helps in reducing the inflammation or swelling, which would help to speed up your recovery. Then physiotherapy, it is also an important part of the management, due to which the physiotherapist will teach that how facial exercises has to be done, and which can help the strengthening of the muscle, in which the face muscles will start to improve for their normal condition and coordination with the range of the movement. Alright. Then comes the surgical management. What should be the surgical management for the patient with the Bell's palsy? Facial nerve decompression will be there. Oculi fat lift will be there, means if there will be fat on the oculi part, we have to lift it or we have to subside it. Then implantable devices we have to we have to implant, like gold weights or placed into the eyelid, so that it should not affect more, or pterisophy we have to give. All right. Then transportation of the temporaris muscle we have to we can do. Facial nerve grafting we can do. Direct brow lift. I am not explaining the surgical management because this is only your assignment, so that you should explain all these, because I had told you in the lectures as well. So these are your surgical management. You have to write it down on your copy as your assignment. All right. Sorry. Now the nursing management. These are some of the nursing management, like cover the eyelid with a protective shield at the night, apply an ointment to keep the eyelid closer due to sleep, or we have to we have to see. I cover the eye with a protective shield at the night, apply eye ointment to keep the eyelid closed during the sleep so that it should not irritate the eye. Close the paralyzed eye manually before going to sleep. Wear a round sunglasses or goggles to decrease the normal evaporation of the eye. After this, we have to we have to teach about the maintaining of the muscle tone. Show the patient how to perform the facial massage with gently, or upward motion several times a day will help the patient, so that he can tolerate the massage. Demonstrate the facial expression as well, such as wrinkling the forehead. Then instruct the patient to avoid exposing to the face to the cold and grass, or in the diet and nutrition. What we have to instruct the patient to chew on an unaffected side of the mouth. Don't chew from the side where the affected side is there. Give frequent mouth care, being particularly careful to remove residues of food that collects between the cheeks and the gums, because it is very actually uh, painful part. If you are because sensation will not be there, you can chew your gums as well. All right. And there are certain more nursing management which you have to follow, like that if you know uh, like instruct the patient to avoid exposing to the face, like don't expose your face so much. Assess the patient for the knowledge change in the structure function of the body, or assess the patient to identify the facial changes, like if you are taking medicines or if you are taking the physiotherapy, just try to scale them, that how much of extent we had been recovered. All right. You know then we have to see that within 1 hour of the nursing intervention, whether the patient will remain free from harm resulting from the visual disturbances or not. All right. Assess the patient knowledge of change of a structure or the function of the body. Assess the patient to identify his actual changes. Encourage the verbalization about the concerns of the disease process and the future expectations. These all are the nursing interventions where you all have to implement, or you have to ask the patient. Then assignment, describe the surgical management as it is mentioned in the previous slide. I told you this one. You have to explain all these surgical management and try to turn your copy and kindly mail it to me. All right. Thank you. So then what we are going to do, we just take a review. We had studied today the introductory part, the definition, types, etiology, the types of the etiology, and pathophysiology, sign and symptoms, alright, diagnostic evaluation, medical management, surgical management, and nursing management we had seen, and one assignment has been given to you. Thank you. If you had any queries, kindly contact me. Thank you and have a nice day.